Employee duties. Regarding first aid. Familiarization with the location of first aid equipment and supplies. Every employee must know where on the factory premises the first aid kits, defibrillator, AED, and other necessary materials, such as dressings, bandages, disposable gloves, are located. It is advisable to remember the locations of these points both near your workstation and in key areas. For example, near the main corridors, in the changing rooms, or close to the emergency exits. Response to incidents and accidents. If an employee notices someone who needs assistance, for example, showing signs of burns, cuts, loss of consciousness, or difficulty breathing, they must immediately stop working and approach the victim. If the situation requires only minor intervention, for example, a small cut, it is sufficient to use the supplies from the first aid kit. If the threat is more serious, help must be called. It is best to notify the supervisor, foreman, and/or call the emergency number 112. If necessary, inform other employees about the situation and ask for additional assistance. Providing first aid in accordance with Occupational Health and Safety (OHS) standards. Always ensure your own safety, for example by wearing protective gloves, as well as the safety of the injured, for example by removing the source of danger if possible. In situations requiring specialized assistance, for example, extensive chemical burns or serious injuries, act according to the instructions received during your health and safety training and immediately call for qualified services. Providing psychological support. The injured person may be in shock. You should calm them with reassuring words. Let them know that help is on the way and encourage them to remain in a safe position, for example, lying down or semi-sitting, depending on the type of injury. If the victim loses consciousness or has difficulty breathing, begin cardiopulmonary resuscitation, CPR, provided that you have received the appropriate training. Operation and use of the defibrillator, AED. The defibrillator, AED, is a device that can save a life in the event of sudden cardiac arrest, NZK. In the plastics factory, the AED is usually located in easily accessible areas, for example, near the changing rooms, at the reception, in the concierge area, or close to the main corridors. Here is a detailed description of its operation, location and access. The defibrillator is typically housed in a distinctive box or cabinet marked with AED. To use it, you must open the box and then remove the device. Powering on voice prompts. After the AED is turned on, usually by pressing the on button or by opening the cover, the device begins to issue voice prompts that guide you step by step on what to do. No specialized knowledge is required. Simply follow the device's instructions. Preparation of the electrodes and the victim. The AED has 2 electrodes, stickers, that need to be applied to the victim's exposed and dry chest. One electrode should be placed below the right collarbone, the other on the left side of the chest, slightly below the armpit. The device often includes images or instructions indicating the exact placement of the electrodes. If there is a lot of hair on the chest, it may be necessary to quickly remove it. Usually a disposable razor is included in the AED kit. Heart rhythm analysis. After the electrodes are applied, the AED automatically analyzes the victim's heart rhythm. During this time, you should not touch the victim to prevent the device from receiving incorrect signals. Shock or no shock. If the AED determines that defibrillation is necessary, it will instruct you to move away from the victim and press the button to deliver the shock. If the device deems that a shock is not needed, it will instruct you to continue CPR if the victim is unconscious and not breathing. Continuation of CPR and further analyses. After a possible shock, the AED will instruct you to resume chest compressions and rescue breathing if the victim is still not breathing. After several cycles, the AED will reanalyze the heart rhythm and may either instruct another shock or to continue CPR. Termination of AED use. Do not remove the electrodes from the victim until medical rescuers arrive. The device itself will indicate when to cease actions or how to continue them until qualified help arrives. Key principles of first aid in the factory. Every employee must know the locations of the first aid kits and AED and be able to use them in emergency situations. If the victim's condition requires immediate assistance, call emergency services, tele 112, and notify your supervisor. In the event of loss of consciousness or cardiac arrest, perform CPR and use the AED according to the voice prompts provided by the device. Never risk your own safety. If you cannot safely provide assistance, wait for professionals and warn others of the danger. After any intervention involving supplies from the first aid kit or the defibrillator, be sure to notify the foreman so that the equipment can be replenished and full readiness is maintained in case of further incidents. By adhering to these rules, you can significantly increase the chances of providing effective help and minimize the risk of serious health consequences or workplace accidents.